Dr. Night Echoes. I used to work as a security guard at a hospital. One night, while doing my rounds, I went into the surgery wing. As I was walking down a hallway, I saw a doctor standing in front of the whiteboard where all the scheduled surgeries are written. I said, "Hello, doctor," and kept walking, but he didn't respond. He just kept staring at the board, completely focused. When I got back to the security office, I mentioned to one of the older guards that I'd greeted a doctor who didn't say anything back. I asked if that was the rude guy they'd warned me about. He looked at me and asked where I'd seen him. I said, "In the surgery ward." That's when he gave me a strange smirk.
He explained that the surgery ward closes at 9 p.m. and that all patients are moved to the monitoring wards after that. No one should have been there. Then he asked if the doctor I saw was staring at the schedule board. When I said yes, he nodded slowly and said, "You just met Dr. Lewis City." Apparently, many years ago, one of the surgeons went up to the helipad and jumped off the building. Seems like he never really stopped working.
I worked at one of the last Booth homes for pregnant girls in the early 2000s. The place had a dark history with many dead babies and some dead mothers. We experienced a number of creepy things there to the point that I brought it up in a staff meeting. The social workers just said it must be time to have the building blessed again. What stuck with me the most was the baby swing. One night I came into the living room and found it swinging by itself hours after all the teenagers were in bed. It was an old mechanical wind-up swing. You had to turn a crank to start it, and there was no electricity involved. There was no way it could have started on its own, yet it was swinging full force. I was completely terrified, but I said, "If you want to swing, I will be happy to wind it up for you." But when you do it on your own, it frightens people. Every night, for the rest of the year so that I worked there, I wound that swing up and let it go. I told other staff members, and I believe they did the same. I like to think it was a sweet baby ghost who just wanted attention, and we gave it attention. Later, they closed the program for parenting teens and made the whole place something else.
I used to work on an oncology ward as a nurse. Our side rooms were reserved for end-of-life patients on palliative care. One patient we had been nursing for several weeks died early one morning. Last offices had already been done by the night staff, and the patient had been moved to the hospital morgue. So all that remained was to clear the room of personal belongings and tidy up. I sent a student nurse I was mentoring at the time to do this, while I continued with the drug round. The student had known the patient fairly well and was comfortable with the task. About 10 minutes later, a colleague came to me and said that my student had come flying out of the side room, white as a sheet, and was sobbing in the staff room. I went to find out what had happened, and the student told me she had been cleaning the sink area in the bathroom when she glanced up and saw the deceased patient reflected in the mirror, looking at her over her shoulder. My student was a sensible girl, not prone to hysterics, but for the rest of her placement on that ward, she refused to go near that side room. I am an ICU nurse. We had a septic patient in the unit. She was 29 weeks pregnant. She went into labor during my shift, and we delivered her baby stillborn. I did post-mortem care on the baby and got the proper transport container. I walked the baby down to the morgue. It was the middle of the night, and I was in the elevator alone. Suddenly, I heard a baby start crying. I froze for a moment, then completely lost it. I ripped open the cover and was about to unzip the bag when I heard a calm, male voice say, "Hush, little one. I've got you. No need to cry." The crying stopped right away. I was shaking as I opened the bag and saw what I already knew would be there. A still 29-week-old baby. I'm a big, bearded, 40-year-old ICU nurse, and that was the scariest thing I have ever experienced. No one believes me. Even now, I still do not know what that voice or the crying was, and I do not ever want to find out. I was on the night shift when it happened. The man had collapsed in the bathroom during a cardiac event. He fell forward with such force that his head went through the drywall. He died instantly. The maintenance crew patched everything the next day. The smell of fresh paint and plaster hung in the air for hours. By the evening, the room was ready again. A few nights later, we admitted a new woman to that same room. She was quiet and polite when she arrived. Nothing unusual. Around 2 a.m., I was finishing up charting when she stormed out of her room. Her face was pale and angry.
She slammed her hand on the counter and said, "Who's going to tell that man to get out of my room?" The other nurse and I froze. She went on saying, "And when are you fixing that giant hole in the bathroom wall? It looks horrible." I looked at my coworker thinking she was making some kind of joke, but she was dead serious. I tried to calm her down and told her no one was in her room and that there was no hole. She didn't believe me. I followed her back just to show her. The lights were still on. The bed was neatly made. She pointed toward the bathroom, whispering, "He was standing right there." I stepped closer, but she grabbed my arm hard. "Don't go in there. He doesn't like it when people stare."
Her voice dropped, almost trembling. The woman screamed and backed away. That room stayed empty for 2 weeks after she was moved out. The paint never seemed to dry right, and every now and then, when the hallway was quiet, we'd still hear a faint knocking coming from the wall. Never really believed in things like ghosts or spirits, but one night made me think twice. I used to work as a medic in a small, rural area. One call came in for a man having a heart attack. We picked him up and started the long drive to the hospital. I gave him his IV and medicine. Then I tried to keep him calm by talking to him. After a few minutes, he started looking to my left and talking. It sounded like he was answering someone I could not see. I thought maybe he was getting confused because of the pain. I asked who he was talking to, but he did not answer. He just smiled a little and said, "You know, he died in here last week, but said you were really nice." That made me stop cold.
I asked what he meant, and he started describing someone, a young man, the way he looked, the way he talked, even what he was wearing. Everything he said matched a patient we had the week before, a man who died in the back of the same ambulance after a bad car crash. I never told anyone about that man except my partner. The new patient could not have known. He just kept talking, softly, like he was still hearing someone I could not. He said the man was sitting right next to me and smiling. I did not look. I could not. The rest of the ride was quiet. The patient survived, but I could not stop thinking about what he said. Now, every time I drive that same route, I feel like someone is still sitting in that seat beside me. I was an RN working in a hospital in a very well-off town in Mississippi. The hospital had 2 ICUs. The second one was an overflow unit on the 3rd floor. There were 7 rooms in that unit, and room 2 was known to be haunted. Many nurses saw something walk into that room, but every time they checked, it was empty. One night, a nurse had a real patient in room 2. It was around 4 in the morning, and she went in to change the patient's dressing. She took the supplies, and the patient asked what she was going to do. She said she was there to change the dressing. The patient looked confused and said that another nurse had already done it about 30 minutes ago. The nurse checked and saw that the dressing was fresh. She went out to the desk and told the other nurse thanks for doing it. The other nurse looked at her and said she had not changed anything. They both froze. No one else was on the floor at that time. Later, I heard that an RN who had worked in that hospital for years had died in that same room. None of us liked going near it after that. I was once working at a mortuary and had to pick up a man from the medical examiner's office. When you do that, at least where I'm from, you get a receipt when they release the body to you. The receipt lists all of the personal belongings that are with the deceased. When I brought the man back to the office, I opened the body bag to make sure all the belongings were there and to double-check the receipt. When I opened the bag, I was stunned to find that this man looked almost exactly like me. He was my age and had similar tattoos in the same spots. He had the same long hair I did, and even wore the same style of jewelry I was wearing. It took me so off guard that I stood there having an existential crisis until the embalmer came in and said, "Hey, Spartan M00, how's it going?" "Ah, holy shit, that guy looks like you." It's the only case I've ever had nightmares about. In my dreams, I'm the one in the body bag while the deceased man is the one opening me up.
I remember that night too clearly. My dad had been in the hospital for a few days, and I had been running back and forth half awake, waiting for updates. When I finally got home, I turned off my phone ringer and crashed on the couch, still in my clothes. It must have been around 1 a.m. when the doorbell rang. It was not loud, but sharp enough to cut through my sleep. At first, I thought I had imagined it. Then it rang again. I got up, with my heart pounding, and went to the front door. No one was there. The porch light was on, and the street was empty. I looked around the yard, checked the driveway, even peeked down the sidewalk. Nothing. The kind of quiet that makes you feel watched. I went back in and locked the door and just stood there, unsure if I should laugh or feel uneasy. When I walked past the table, I noticed my phone face down. For some reason, that made me uneasy. I picked it up and turned the ringer back on. Not even a second later, it buzzed in my hand. Unknown number. The hospital name flashing on the screen. A woman's voice came through, calm and professional. She said my dad had passed away not long ago and asked if it would be okay to discuss organ donation. I remember staring at the door while she spoke, the same door that no one had been standing behind a minute earlier. I did not answer her right away. I was listening for the doorbell again, for something, anything. But the house was completely still. I worked as a nursing home assistant for a short time before grad school. It was a private facility, and I rotated between 3 different houses. Each house had 6 residents and 2 staff members. When I first started, all the residents were women. One afternoon, my coworker and I were in the kitchen preparing lunch when we suddenly heard a loud voice screaming for help. It was clear and desperate. We froze for a second, then both ran off in opposite directions to check on our residents. I searched every room on my side of the house, but no one was there. Everything was still and quiet. When I returned to the kitchen, my coworker was standing there, wide-eyed and pale. I asked her if she heard it too, and she said yes, but that no one was on her side either. We stood there for a few seconds in silence before both of us turned toward the window. Outside in the garden, we could see all the residents sitting together, enjoying the sun and chatting by the roses. Every single one of them was accounted for. That was when we both realized the voice we had heard was male. The sound of it was too deep and too loud to belong to any of our residents. Later, I learned from one of the senior staff members that a male resident had lived there years before I started. He was a World War II veteran who had suffered from severe PTSD and night terrors. They said he often hallucinated and screamed for help in the middle of the night. He had passed away in that same house. After that day, my coworker and I never talked about the voice again, but I always felt uneasy every time I walked through that kitchen. It was like the walls still remembered him calling out.